were trying to develop a system that could better monitor patients' symptoms while they were at home, because after you get chemotherapy, you go home and you don't have any support system, and often patients are reluctant to call. They sort of normalize some of the experiences, and of course then they go back to their doctor at the next time that they're supposed to get chemotherapy, and a lot of the symptoms have already gone away. And so we're really trying to capture what happens in that period in between. And so we developed, using an interactive voice response system, what it was called initially telephone link care. So it was a system whereby patients would call in on a daily basis and they would be screened for a variety of symptoms that were common during chemotherapy. And if they developed the symptoms at a threshold level, an alert was sent to their oncology physician and nurse. And so we were trying to see if by improving this communication about the symptoms for patients, that would in fact improve the quality of their symptom management and of course their outcomes. And basically what we found is that the system worked great. Patients really liked it. They called in regularly. So we were able to really, it was very exciting to capture that kind of information. But when it got to the providers, they didn't respond as we had thought. So either they didn't follow up with the patients, or they normalized it, or I think maybe sometimes even they weren't sure totally what to do about the symptoms, and so our outcomes didn't improve. And part of it was, and we measured whether or not there was this communication in between, it didn't happen as we expected. So in the second study, which we just completed, we basically used advanced practice nurses to sort of case manage the symptoms of the patients. So rather than relying on the providers, we developed another system, a case management system, whereby all the information from the patient reports went into that system, and the nurse practitioner would get online, they'd get a list of all the patients and whether they had alerted, and then we developed within the system an evidence-based approach for the nurse practitioner to respond to the symptoms. So we used national guidelines where they existed and developed a system that said, if the patient has this problem, here's the things that you might do. And that actually worked very well. So we presented this at ASCO last year. We basically found that patients had less symptoms. They had more symptom-free days when they received this follow-up care. So we're pretty excited about that. And we've actually just been working to expand the system and to try to create it in a way that we could translate it into practice. So we're modularizing it, so a practice could say, oh, I want to monitor this particular thing for this patient, and potentially could also be used in other settings such as surgery, for example, for post-op patients.